both given your testimony. Mr. Morris, I think you were before our committee last year, and we spoke about fostering better cooperation between healthcare providers and anti-fraud efforts, and both of you alluded to this in your oral testimony. I'm interested in further exploring the role of physicians in preventing healthcare fraud, identifying it, helping you on the front end to identify it. Certainly physicians, nurses, other medical professionals are in a unique position to pick up on fraudulent activity on the ground. It's sort of, direct intelligence on the ground as to what's happening. And I know you and I spoke about the case in Lafayette, in my hometown, and how it involved a whistleblower who was actually a partner of a physician who brought something to light that maybe for years had been ongoing and really was really not detectable until that whistleblower activity. So what barriers are there now that you're seeing that would inhibit physicians and other providers from coming forward and helping you in your efforts to identify potentially fraudulent activity?
I think there are a number of opportunities we have to do a better job to reach out to physicians and other professionals. Part of it is through education. I made reference in my written testimony to the roadmap for new physicians. And the idea behind that was actually spawned by medical residents who told us they didn't understand what the fraud and abuse laws were. So we put together a booklet that will help them not only protect themselves, but also be able to recognize when a practice is doing something that they might not want to get involved in. So education is part of it. I think every time we go out and demonstrate our commitment to compliance, demonstrate that we recognize that this is a complex program and that there are lots of opportunities to make mistakes, and that it's incumbent on physicians to embrace compliance, that's the way to go, that we don't, we're not a hammer looking at everything as a nail. I think building that trust goes a long way. Next week, we're meeting with the American Medical Association to get their ideas on how we can work better and ways we can spot opportunities for collaboration. So I think a big part of it is education, and a large part of it is also sending the message of compliance, that physicians and nurses and other professionals can be our partners in ensuring that waste, fraud, and abuse don't harm our program.
Thank you. Dr. Budetti?
Yes, thank you, Mr. Chairman. We have had a series of regional fraud prevention summits, and at each one of the summits, the Attorney General and the Secretary have chaired them, and then we've had panels with law enforcement and providers and beneficiaries, and then I've put together breakout sessions with providers at each one of the regional fraud prevention summits. And I have to say I'm extremely encouraged by the response of physicians and other providers that I've been meeting with in these groups, that they are now very interested in working with us on this, to the point where I've been so impressed that I actually have created a position within the Center for Program Integrity of a medical officer. So I'm hiring a full-time medical officer to work with the physicians and other healthcare providers around the country on program integrity issues, both to get the message to them, but also to listen and to figure out what it is that we can work on together and what we could do different inside of CMS that would be more responsive, because the message we've gotten from the providers was very straightforward, but it went in two directions. It was, on the one hand, they really want to work on this. On the other hand, they want us to do what Mr. Morris just said, which is not treat everybody the same. Recognize the big difference between fraudsters and honest physicians, and we're committed to doing that. So I think there's a real opportunity here to work very closely with the medical community and other providers, because the enthusiasm seems very strong on their side.
And if I could add one more thing, we share the view that physicians should be part of our team, and we also have a chief medical officer who provides valuable counsel to us as we do our work planning and ensuring that we best understand what's going on from the physician's perspective.
I know in the private sector, the private insurers often do go through credentialing processes. Can you talk a little bit about what you're doing now at CMS in that regard?
One of the major provisions in the recent legislation that will take effect, our final regulation will take effect on March 25th, speaks to screening of applicants to be able to bill Medicare and Medicaid. We all know that that's been a kind of a soft spot in the programs, people getting in too easily. But under the new authorities, we are doing risk-based screening so that categories of providers and suppliers are assigned to different levels of risk with different levels of screening. Then they also have to revalidate periodically every 3 or 5 years, depending upon the category. So this is a new approach. It's going to mean a much greater degree of scrutiny for the high-risk providers and about the same scrutiny, but maybe done more efficiently for other providers. We get something on the average of 19,000 applications every month to become a provider in Medicare. So it's a large number of people that we have to screen through, because most of them are going to be honest, of course. But with our new screening systems, we're very pleased to have that authority, and we're putting it into place with a great deal of energy.
Thank you. Mr. Lewis, you may inquire.
Thank you very much, Mr. Chairman.